As long as I can remember, I've suffered with allergies, whether it was to eggs, which is my big trigger. I have an unknown allergy, which I have my EpiPen to stop me from going into anaphylaxis. I've had hay fever, asthma, skin rashes, mostly in periods throughout my whole life. As I've got progressively older, my symptoms got progressively worse and I have become more and more sensitive. Before I went to Dr. Herman, I would vomit most weeks, and then I finally get relief when I vomited, and that would be from eating something as simple as a red pepper or red meat or anything really, or oats. It could have been anything that I was sick from. So I got to the stage where I could eat basically nothing without having a reaction, and I just continued to spiral down a path of getting worse and worse. I suffered from really bad constipation and bloating as well. Every day, it never eased. My mum, she would have tried to massage my tummy in the mornings before I had college, and that was the only thing that could give me very short-term relief. My energy, I couldn't do anything. I couldn't really perform daily tasks to any much degree at all. I would have been in my bed. I think I remember one time being in my bed for 2 or 3 days without doing anything. I couldn't really get up. I couldn't sleep because I was so itchy. And then when I did sleep, at one stage I was waking up maybe every 2 hours to putting creams and lotions on to try and soothe my skin to some degree. I couldn't go near animals because at one stage my face would swell, and I just had really bad asthma and hay fever, and my skin rashes would get worse. My mum would know a lot more as to what I went through in my earlier history when I was a baby, because I was very sick then too, you would say. Yeah, from she was born, she had difficulties with her skin reflux. She was my firstborn and I had no previous experience. When things started to get intolerable, I remember me having to run the washing machine 13 times in one day because of her reflux and her little skin and her scratching. And we then started down the path of looking for people to help her. We would have went to the doctor and she was referred then on to skin specialists, and it has been a journey of trying to get her some comfort and help, and yet we never really got anywhere to any great degree. I was always very worried about the impact of steroids, using things like that. She couldn't even deal with, at one point she was to be wrapped, and she couldn't deal with the petroleum that was in the wraps. So none of this was an answer, even in the short term. The years went by, there was a period of time and her skin actually did improve up, but her food sensitivities kept getting worse and worse. And then she reached her adolescence years and truthfully everything nosedived. The last 2-3 years have been nothing short of a nightmare for her. We would have been on holidays abroad and she would have to walk around with a black denim jacket to cover up her skin because it was so raw and inflamed, and she was so embarrassed and uncomfortable. We loved to eat, and it came to the point that we couldn't even really go to restaurants, so we just tried to go to organic shops, buy food and cook when we were on holidays, just to try to relieve her symptoms. So her day-to-day living, her normal was anything but normal in anybody else's eyes. As a parent, it was soul destroying to watch a young girl who should be in her prime unable to actually leave the house.
If I recall that it's like scratching the rash. Was there bleeding that was coming out of that rash? Or rashes around your body? It was everywhere around the body. So
yeah, it was everywhere. There wasn't really at a stage, there wasn't really a part of my body that wasn't covered in a rash, right up to my face, my eyelids, my nose, everything, my neck, arms, everything. And then at night, there wouldn't have been one morning that I didn't wake up where there wasn't blood over my sheets from where I would have been itching myself. I bled in my sleep every night. And then, as I said, I would have been up putting anything I could, chamomile lotion, aloe vera, anything I could to try and soothe the itching to some degree, to try and let me have some night's sleep. It would have been about my hair, everything. It just was no part of my body. And then I suppose it got really bad whenever my hair started to fall out. Then too, and the stress that it was causing me to try and do that amongst exams and college work and everything proved very difficult.
The asthma symptom, was that something that you needed an inhaler for, or was that something that was just like you felt short of breath? Were you wheezing with that? How bad was that respiratory problem?
Well, as early as I can remember, you'll remember a lot more than me, but as early as I can remember, I've had awful asthma, which I would have had an inhaler for. And there's times when I remember being rushed into hospital from having an asthma attack, or my dad and mum would have brought me in a good few times, you would say. And then over the years, I've just always had a problem with animals.
Hot and cold environments.
Yeah, if I went from a really hot environment to a really cold environment, I would have got asthma, or if I had any food allergies, asthma would come along with that as well. At one stage, I was taking 20 different supplements or more in a day to try and do something to keep my symptoms at bay, and trying different things all the time.
How many doctors total for the skin, for the constipation, for the bloating, for the fatigue, for that whole rash, for the hair falling out, for everything that you've dealt with? You had horrible period problems, monthly cycle problems. So how many different doctors can you kind of give a range of a number of doctors that you've been to over the years, and different types of practitioners that you've been to try to come up with the relief that you're experiencing now?
Well, aside from her GP, aside from them, she would have been with a skin specialist, and she would have been with asthma clinic, and that would have went on right until probably her teenage years. Every year that was monitored. She would have then went under different consultants because of her EpiPen management and her anaphylaxis. She really was under care right up until she was discharged, as she became an adult patient. We then would have had, she had bouts of severe fainting, and as you refer to her cycle, so she was under a consultant for that. So for the best part of her life, she's under one consultant or another for one thing or another. But then there would have been also times when she was in hospital, and she would have had she's had scans done, and she's had the epilepsy,
ECGs and MRIs and
those kind of things. Thankfully, they all came back clear as far as anything untoward, but nothing to help her ongoing set of symptoms.
Yeah, but every year in the hospital for something until I was 18 now.
Pretty horrible to go through all of that, those very expensive investigations through CT scans and MRIs and blood tests and x-rays and allergy tests and all the things that you've done, and nobody could come up with a reason. Nobody can come up with why, or with an exact, good, effective, safe and effective protocol to help you get better until now.
That's one thing. Trying to get help and an answer and a solution is totally different thing, and that wasn't forthcoming.
And then we moved on the more natural health route after that. So we would have tried practitioners in various fields like functional medicine and stuff after that, and that probably provided for as little as a few weeks or a month, a few months at one stage, 2 months. That provided short-term relief, and then everything returned and back again. So I've seen a good few practitioners in that field as well.
We tried everything.
When I went to Dr. Herman, started my protocol, within about a week and a half to 2 weeks, I dropped nearly a stone, and that was what I believe to be sort of like water retention, water weight, toxic inflammation, water weight, and my rash subsided to it improved about 60%, I would say. And then over the course of my treatment, when I would treat various different things that was in my protocol, my skin just continued to get better and better. And that was the main thing that I noticed. That was the most important thing to me, I suppose, that got better, and it enabled me to have a life again. And along with that, then other symptoms that I hadn't even really much mentioned to Dr. Herman that I wanted to fix. Continued to get better as well. My constipation subsided. My bloating got so much better. I was able to eat things that I hadn't been able to eat for years when I think back, without any sort of symptom. Now that I'm finished my first protocol, I haven't deviated. It's still the same. I can eat stuff now that I haven't been able to eat in a very long time, and I can enjoy basically everything. Yeah, so it's a massive, massive, massive improvement.
To go through that and then go to Dr. Herman, take one protocol, and have my daughter declare, this is my best summer ever.
Awesome.
That's all I wanted to hear. And that's how it has been since.
What a blessing.
I'm a new girl now. After my one protocol, I couldn't be happier, and I haven't felt this good in years and years. I don't actually remember a time where I've been able to say that I really have no symptoms of any description.
Awesome.
I suppose the truth of the matter is, Dr. Herman, that you were nearly our last shot. We went to you, but we had known someone who had tremendous results. So we had a confidence that things would be better. We maybe just didn't anticipate it would be as good as it was after one protocol, and that's just delightful. So we thank you for that.
You're welcome. My pleasure. I'm so happy for you both, your whole family. So I really appreciate it that you're sharing this with everybody.
It's so different for me this time, because last time I was literally looking at my calendar every day wondering when my treatment would be here. And this time I'm in such a better position where I'm very glad that I have another protocol still to get rid of the final things, but if I had to live like this, I'd be very happy to live the way I am at the same stage.
It's going to be even better. I'm so happy for you. I love seeing your smiles. It's so rewarding.